Here we are. Today's topic is we're going to talk about the basics of burnout for the causes and remedies in a research environment. First of all, before we go through the whole talk, I'd like you to know that if you are currently in a mental health crisis and need help, there are resources which you can reach out right away to. For example, Samaritans.org and other helplines, they provide not only call hotlines, but also chat hotlines in English and many other languages. So this can be a point of where you could go for help in case if you need. You can also, even if you don't speak German, walk into ER in case of any emergency, including mental health emergencies. And even if you don't speak German, they will be able to find a translator or someone who speaks your language and help you. Some uni clinics have a burnout Sprechstunde, so-called, so speaking hour. Typically, most of it have it within psychological and psychotherapy wards. You can in psychiatry wards, so you can check a look at it. And on Therapy.de, you can try to find a therapist, and you can filter not only by language, but also by location. And also, Max Planck Society has a provider for employee associations, some program for assisting employees when they need the mental health support. From the 1st of October, they changed the provider, so it's not Furstenberg Institute anymore. Please go to intranet and check who is the provider, but it's also free of charge and covered by Max Planck. And overall, therapy in Germany is covered by basic public health insurance. So if you're considering therapy and are afraid of costs, please don't be. In Germany, it's covered. Finally, Dragonfly Mental Health is not a healthcare provider organization. I am not given this talk as a healthcare provider. This talk today is educational, and of course, the talk which I'm giving now is not a medical advice, and it doesn't substitute to speaking to a medical professional. I am, however, I studied medicine and did my MD, then I did my PhD in Germany, and I did my postdoc for 4 years in Max Planck Institute in Dresden. And then I moved to industry. However, I still stayed connected to science, to scientific field. And during my postdoc time, I organized the mental health initiative in my local Max Planck, and then also the mental health collective together with other people. And also we actively participated in creating mental health awareness week, the global ones. And I also am a co-founder of Dragonfly Mental Health, and this talk, which I'm giving today as a part of the programs which Dragonfly Mental Health gives. Dragonfly Mental Health, we were officially founded as a nonprofit in 2020. We were created by academics for academics. And at the moment, we have more than 300 volunteers from 45 countries. We aim to cultivate excellent mental health among academics worldwide. What do? We create educational content and deliver it on campuses and globally. For example, programs like this being delivered today, or locally at some institutes, or globally at some conferences. So all this customized education processes, skills training, and anti-stigma strategies and support. We also work on creating the community through Dragonfly Cafe networking. It's a free peer support space for networking. It's also an excellent point for entry for volunteers and sometimes clients. And we also, of course, do the research for a global consortium, and we're trying to understand the scope, causes, and solutions in academic mental health issues. 2 days ago, we have delivered our 200th program, also as a part of Mental Health Awareness Week by Max Planck. We're so proud of it. We reached more than 20,000 academics in 17 countries and globally. In our programs, they work. We do the quantification and always check whether we always check for the feedback essentially. So today we're going to talk about the basics of burnout, and I would like to underline that this talk today is a peer perspective. So it's from fellow scientists to fellow scientists. I'm not running the whole institute or some organization, so this is not a systemic approach to change within the burnout, but it's rather to help your peers and yourself to deal with burnout. So we'll also talk what helps with burnout, of course, and providing some solutions, and we'll go through the group discussion. If you have any questions, I'm always happy to chat. Yeah, burnout. It's a tough one. But in order to understand where burnout is within the mental health spectrum, let's have a look at it. I think interesting. Here we have. So this is mental health. The person is striving, and they essentially have no problems, and this is how. So they feel really energetic and they're like functioning well. If we talk, I don't know, interesting. It's probably clickable. Okay, so if the person is dealing with the stress, um, and we all deal with the stress at a certain point, but still the either the amount of stress is manageable or the person is dealing with the stress in a proper way. So people are still functioning well, they're still striving, they're working under stress conditions. However, it's still working. So the next thing which can happen and does happen is sometimes is that either the stress is not being taken away, or we're not able to cope with it, or it's too long, or it's too acute. So in cases when we're not coping really well with the stress, we enter the condition where it is a distress. So during the distress, we don't function that well. We're still somehow functioning. However, we see the change in our daily habits. So we sleep more or less, we eat more or less, we exercise more or less than usual. So all these kind of things are of course affecting someone is asking me if it's possible to choose simultaneous translation. Not to my knowledge. I only do English. I'm sorry. So yes, in this is the case of distress. And if the person is not taking care of it properly, then distress can lead to the disease. And disease is something like depression, anxiety disorder, when people's everyday life is affected by the disease. So they see that they already been their life and daily life is challenged by the disease. So it's not only they're eating more or less, but they're like actually gaining weight, or they have an insomnia, or they're sleeping too much, to the effect that it affects their daily life, their daily habits, their perception of life, of the way they feel comfortable with, and so on and so forth. I'm sorry. So burnout here is in between distress and disease. Burnout is not a depression, and I'll go through it here in the slides, how exactly they differ. So, but burnout eventually can trigger the development of depression and some other diseases. So in case if we feel like we're reaching burnout, we need to take care of it in order to get back to more distress and stress position rather than to the disease position. So that's why I'm really would like to point out today the symptoms where you can by yourself and within your support to your peers can try to figure out whether the burnout is approaching or not, or what can be done for me in order to like move towards the mental health of the spectrum rather than to crisis. And in this case, if disease is not taken care of, crisis can lead to severe like psychotic episodes, suicidality thoughts, all this kind of things where the urgent care and the medication and the mental health interventions are needed. Okay, we moved from this first slide. So scientific settings, and of course, all of our talks they're focused on the scientific settings, and burnout within scientific settings, as well as general concept of mental health. It has some specific features. For example, while people are studying and moving to industry or moving within the career within science, so from master's student to PhD student to postdoc to staff scientist or to professor, most of the wellness programs they target junior researchers. So bachelor students are taken care of by university, sometimes masters. But when you're a PhD student or a postdoc or a staff scientist, you're on your own. So there are no, or essentially, or maybe just some now at the beginning, but eventually there are no wellness programs targeting these groups of people. And of course, cultural and systemic barriers within scientific circles, it always makes us less likely to seek support. This topic is still stigmatized. People are still embarrassed to admit that they're going to therapy or taking medication. So in science, there's a lot of stigma about it. And of course, postgraduate education, essentially, and the follow-up career path in industry or in academia, it comes with the unique pressures of peer publications, running experiments overnight, all these kind of things which make us stress. They're unique for scientific settings. And when we're talking about burnout and other mental health illnesses, we need to take it in consideration. So burnout, as defined by the World Health Organization, is a syndrome resulting from chronic workplace stress that has not been successfully managed. What is important here to underline that it is connected to a workplace stress. So when it comes to, for example, depression, it can be connected to many things, but in let's say biologically driven, environmentally driven. But when it comes to burnout, it is essentially connected to the workplace stress. So it may manifest as a feeling of energy depletion or exhaustion. It may manifest as when the person is increasing this mental distance from the job or from the colleagues, or they're feeling negative about their job or colleague, or even cynical sometimes. And of course, this leads to reduced professional efficacy. Who can suffer from burnout? Essentially, anyone who is doing a goal-oriented activity. PhD students, of course, postdocs, of course, the goal-oriented activity, writing a thesis, submitting a defending thesis, writing a publication, all these goal-oriented activities may lead you to a burnout. Of course, it's not only for scientists, volunteers, students, athletes, parents, and caregivers, clinicians, everyone who has a goal-directed oriented activity can suffer from a burnout. Core components and symptoms. Again, I think it's I apologize. I think it's some sort of visual effects which I'm struggling to deal with. So let me just do it like this. Maybe it will be slightly better. I apologize. Okay, so what we're talking about. There are two core components which are affected by burnout. First is self-reflection. So when we're talking about self-reflection, the burnout can manifest as an emotional or physical exhaustion, then constantly feeling tired, feeling not motivated to go to work. Reduced emotional regulation is to be more, even though I don't like the word resilience, but typically reacting to the things in the way that you under normal conditions would react differently. Cognitive impairment, reading 2 pages and then 2 pages later you're thinking, what did I even read about? Of course, reduced memory and attention is something which we also experience during burnout, and sleeping problems. Another core component is interaction within the social network. So we may feel more irritable, and we may feel that we're withdrawn and distancing from colleagues and from friends. Again, reduced performance within the society and the community, and being inflexible and being cynical about work and colleagues. Another thing which is essential is that burnout is situational. What it means is that burnout can be manifested in one dimension, for example, work-related. But other parts of your life, for example, your bench work can still be fine and you don't feel bad or tired about it. Your personal life can still be not impacted. So it can be one-dimensional, and this is something we also would like to remember. Some people, highly functioning people, and science field is full of highly functioning people, may be able to contain or manage symptoms. So we hear a lot from people, oh, it's not too bad, I'm still functioning, it's not too bad, I'm still writing, not too bad, I'm still performing the experiments, I'm still managing. It doesn't mean that you're doing well. It just may mean that you're just containing or managing symptoms. So again, the common misconception is that since it's non-lethal, I have to learn how to live with this. And we in Dragonfly are strictly against this policy. Another thing is that every day may be different and require different management. So in most of the days you may feel tired, but at a certain point, I mean, maybe you have a toxic boss, and when they're leaving for vacation, you may feel better. So this is something situational, and also one day is different from another. So some days can be much more difficult than others. Burnout is not static. It's not sort of binary. It's a spectrum, and it's not inevitable. When it comes to causes, again, it's chronic stress relating to work or other ongoing activities. Another thing which may contribute to the burnout development is the lack of control. But in case of lack of control, it doesn't necessarily mean that it's a real lack of control. For example, during COVID outbreak, there were difficulties with logistics, and you promised something to your collaborators, but then the EPIs wouldn't be able to be delivered to you, so you didn't fulfill the promise. So this was the lack of control, and mainly to burnout. But also the internally perceived lack of control can also lead to a burnout. Like, oh my God, I cannot control anything. This feeling, even though it may not be really reflecting the reality exactly, but still this perceived lack of control can also lead to burnout. Of course, bullying or toxic work environment relationship, this is number one. Most of us, if not all of us, once in a while experience this, and of course, this can lead to burnout. Life-work imbalance is that something probably better taken care of in Europe compared to the US, for example, but still, of course, as a PhD student, you have, and sometimes as a postdoc, you have non-normalized working hours, you overwork, you do Saturdays and Sundays, so of course this can trigger a burnout. Extra job duties from your colleagues and limited authority to decline the extra job duties. As if you're a PhD student and you're given more and more and more responsibilities, and you don't feel like you have the authority to decline it, and you cannot say no to your boss, of course, at a certain point you will break, and that will lead to the burnout. Another thing which is also very common in scientific environment is disconnection from values. So if you are against animal experiments, but during the course of your PhD or during the course of your studies, you're made to work with mice, for example. So these are the things which impact our mental health tremendously, and of course can also lead to burnout and a lack of identity beyond work. So we tend as scientists to self-identify as scientists. And of course, scientific work is connected to some failure. It's a part of the job. There will be some failures. Some experiments will not work. That's the whole point of the experiment. So when you identify yourself as only a scientist and your experiments don't work well, so the lack of identity beyond work, while the work is not really like performing tremendously, then it may also lead to a burnout. The next thing I wanted to tell you is the burnout cycle, and I think this is nice because it also shows some sort of symptoms, and maybe at a certain point, if you feel like this is where you are at the moment, you could try to figure out and try to get out of this burnout cycle if you feel like it's something you could work on. So let's start from okay. So the whole point of the burnout cycle is that there are causes, which we talked about, that leads to symptoms, and symptoms, they worsen the situational causes. So it's a vicious circle, and it's important that being within this circle, it lowers your satisfaction with the work, and of course, accomplishment and productivity also suffer. If we start, let's say, from exhaustion, which we all once in a while experience, if we don't rest properly, if we don't get out of this exhaustion in a reasonable manner, it may lead to the cynicism. So we're like so exhausted that we don't care anymore, not about our protocols, not about our experiments, not about our colleagues. As soon as we stop caring about our colleagues, we tend to socially withdraw ourselves. So I'm so exhausted, I don't care anymore at all. I don't want to go to get-togethers, to lunches with my group. I just want to be by myself. And of course, this kind of things being constantly in our brain, it leads to the lack of concentration. So we cannot focus on things properly. And since we cannot concentrate and focus on things purposely, constantly, it leads to inefficiency. And when we're insufficient at our work, our workload extends. And as soon as our workload extends and we're still trying to manage all of it, we are coming back to exhaustion again. And so this is the cycle, and I'd like you to think about it. I mean, it doesn't necessarily mean that you can do something right now to get out of the situation, but maybe if you think of your behavior within the burnout cycle, maybe this is something to consider when you're considering on how to get out of the situation. If we're talking about employees' work-related burnout, more than 50% of people, from always to sometimes, feel that they are burned out at work. So essentially 76% together are sometimes feeling burnout. Burnout impacts health and productivity. So 63% are more likely to take a sick day. Interesting. Let me try maybe. No, okay, it's not working, sorry. 63%, so more than a half, are more likely to take a sick day when they're dealing with a burnout. 23% are more likely to visit ER. And there are 50% higher chances for a person to be able to be called for a discussion with the manager about their performance, and 2.5 times more likely to be sick in another job. And finally, 70% less likely to experience burnout if given enough of time to rest and to cope with the things. For pandemic, and it was even worse. And what I'd like to bring up here is that despite the lack of, especially in Germany, like at the moment, we only experience maybe like mandatory face masks in the public transport. Pandemic is still not over. And not only that, but also the mental health state is still struggling and will be struggling for a while from the pandemic consequences. So I really would like you to be careful about it and not to think, hey, you know, pandemic is over, I'm healed. So it can be tricky. In the US survey in 2020 showed that 70% of people and scientists during the pandemic felt more stressed and felt fatigue, and 35% felt angry. More than 50% said that they're seriously considering changing their career and retiring early. And for junior scientists and researchers, the crisis has magnified stresses and already existing issues in academic system. And of course, as if a career in academia wasn't uncertain enough, the pandemic added extra points to it. Now, I would like to talk on what can be done, what helps. First and foremost, educational and cultural change within your campuses, within your lab teams, within your peer networks, within your PhD net and postdoc net. We should be aware of the symptoms and signs of burnout and be able to take rest and to take care of ourselves without shaming ourselves and shaming others for it. Social support, again, within the peer networks and destigmatizing, all this kind of things work to help people to prevent burnout and get out of the burnout. Of course, balancing rest and effort is essential. So we, within Dragonfly, and not only us, a lot of medical doctors as well, we suggest to take complete vacations and not to split them on 2 days here, 2 days there, because it doesn't allow you to fully distance yourself from work, and you're not really resting. Also, when possible, please commit to taking regular breaks. And breaks can be different. So can be different by time. Let's say you work 15 minutes and take 10 minutes break, or work 30 minutes and take 5 minutes break, or something like this. But also, please be mindful about the essence of this break. So some breaks can be necessary, like bathroom or eating. Efficient, for example, going to a printer. And joyful, for example, going out for the coffee or for a walk in the park or something like this. So please, 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 please do joyful breaks as well, not only necessary and efficient, but also joyful breaks. They're essential for your proper functionality. So yeah, okay, exactly. So joyful are also essential. Please make sure that you do them. Improving basic health is something which is absolutely doable in Germany. So of course, let's take about this. We all know sleep, exercise is essential. That's true. A lot of people are skeptical about mindfulness. I was too. I'm coming from a former Soviet Union cluster, and of course, mindfulness as a concept didn't exist there. But mindfulness doesn't mean spirituality. For example, breathing exercises help a lot when it comes to exhaustion and tiredness. So please make sure that you check out the opportunities to try to get into a relaxing mode. And of course, when possible, we would like you to think about improving work communication. So if it is possible, please try to negotiate better working hours or improve accommodations, or we've got managing upward talks and other talks on YouTube, so you can check out and maybe try to be more assertive when you're trying to negotiate it. Also here in Germany, family doctors are pretty easygoing when it comes to sick leaves about burnout. So typically, if you have a reasonable doctor, if not, then please try to find yourself a reasonable family doctor. But so just go to them and say, I feel like I'm reaching burnout. I need a sick leave. And so doctors in Germany are pretty flexible when it comes to issuing the sick leave. So these 5 things as a wellness wheel, so to say, please take care of them. And this is something which may potentially help you to deal with the burnout. Another advice, as we have talked already, is to please try not to internalize burnout as a failure. Burnout is a consequence of a system failure. So it's a toxic system, and it expects people in academia to work long hours, sacrifice their personal lives. It promotes such an approach, and of course, it leads to burnout. But it's not your failure; it's a failure of a system. We also try to recommend that you create ways to detach from stress, whether it's hobby or or just walks or whatever helps you. Again, destigmatizing and normalizing conversations about mental health is something which is very helpful for people not to feel that they're isolated. So it does help to fight isolation. And we recommend to treat yourself like a tree with the sun, water, air, nutrients, grounding, and space. However, if we're talking about nutrients, for example, these nutrients can be whatever you feel like it. So if you feel like your nutrient for your mental health would be to binge watch the new episode of some TV show for a whole Saturday, that maybe is what your brain and body needs. So don't guilt trip yourself for not being super productive. Try to give yourself rest. Again, I would like to just briefly underline that burnout is work-related, that you may feel physical exhaustion and emotional exhaustion, and it all is connected to to the work-related issues. It is not the same with depression, because depression, as well as other issues like the bipolar disorder or anxiety disorders, which are much more common in scientists, 6 to 8 times more common in scientists than regular population, they may have similar symptoms, such as changes in the mood, body, and behavior, and the thought disorder, but the causes are completely different. So the causes can be immune or endocrine dysfunction, sleep or exercise deficiency. Of course, there's serotonergic pathway deficiencies, genetics, and trauma. And so even though sometimes the treatment can be similar, or some particular types of treatment, parts of treatment can be similar, it's still essential to underline that burnout, we're talking about burnout only when it comes to stress, work-related stress. Yeah, so basically, burnout is somewhere in between stress and disease, but can trigger the disease. There are burnout screeners, which people typically, which your family doctor, for example, can give to you when you go to them. So there are several different ways to assess whether there's a person has a burnout or depression or anxiety. So there's screeners, and they're available online as well, so you can check yourself whether you want it. We don't recommend to do it all by yourself. We still recommend to go to the doctor, because sometimes having such an approach, okay, so you go online, you take the screen test, and you figure out that you, according to the test results, have burnout. What to do next? You may feel completely lost. You may feel disoriented. You may feel just not have enough of energy to go to the doctor. So that's why we recommend to go to the doctor and there take tests. But still, you should know that there are different screeners, and it's different. Burnouts from depression, anxiety are robust and distinct constructs. Again, so the resources is the same as we talked at the beginning. Therapy, DE, you can try to find a therapist there. Your family doctor can help. You should check for a burnout speaking hours at uni clinics. Sometimes we also host Dragonfly cafes and about burnout, and yeah, we try to talk about it. With this, I'd like to finish my talk. Thank you so much, everyone, for listening. I would tremendously appreciate it if you let me know your feedback, and if we could, improve the talk somehow. So if you feel like there's something we could improve, which I forgot to tell, or which is something if I told wrong. So anything like this, I will really, really appreciate your feedback. Okay, so with this, I